Hello, and thank you for joining this presentation on selecting a universal screener. My name is Catherine Doherty Kurtz, and I am a school psychologist by training, the project director of the Birch Project, and a postdoctoral fellow at the Boston Public Schools Behavioral Health Department. Thank you to the developers of this presentation, Whitney Walker, Dr. Brian Daniels, and Dr. Stacy Bender from the University of Massachusetts, Boston. So I want to introduce the Birch Project. The Birch Project is the Behavioral Health Integrated Resources for Children project. Its mission is to provide professional development resources for schools and to strengthen the coordination of behavioral health supports across school and community agencies. The Birch Project is led by faculty members from UMass Boston and UMass Amherst, and we are sponsored by Boston Children's Hospital. For more information, please check out our website at umb.edu/birch. Universal Social Emotional Behavioral, or SEB screening, is a critical component of a multi-tiered systems of support framework. And the Birch team has seen firsthand how invaluable it can be to guide intervention planning and database decision-making around students' behavioral health needs. It can help teams think about schools as a system, how to allocate resources, and prioritize where to begin. 3 questions can guide your team as you consider which universal SEB screener is the best fit for your school and community. Every school is different, and when selecting a screener, many factors need to be taken into consideration. If your team is considering selecting a screener for a school district, your needs may be broader in scope, and we encourage you to include a sample of stakeholders from different schools and the community to inform the selection of your SEB screener. Our first guiding question needs to be, is the screener evidence-based? What is the research behind the screener? When your team is reviewing individual screeners, you want to consider the population that the screener was tested on, its reliability and validity, diagnostic accuracy, and fairness. Let's talk more about these factors. Your team should explore if the screener has been tested on a population that is similar to the population of your school or district. When we are reviewing the research in the technical manuals of the screeners and in research studies, we need to review the demographics of the individuals included in what we call the normative sample, also sometimes called the norm, normative, or norming group. What were the ages of the children or adolescents screened in the normative sample? Is this similar to ages you have in your school or district? How about the languages spoken by individuals included in the sample? Racial and ethnic background, area of the country. We also want to think about the needs of our school or district. There are screeners that assess internalizing problems, such as symptoms of anxiety and depression, or screeners more targeted to externalizing or acting out behaviors. Other screeners address both. We also want to review the reliability and validity of the screeners. We think of reliability as the consistency of the scores of the screener, such as, are the items included in the screener that are supposed to be measuring certain behaviors or symptoms getting similar results across the screener, such as items to assess symptoms related to depression? If we administered the screener again, would we get a similar result? If another individual completed the screener, would the results be similar? And is it valid? Are we measuring what we want to measure, and are these areas important for functioning at school? Screeners are not meant to diagnose students with specific mental health diagnoses or classify students as meeting eligibility criteria for a special education disability category. They should be as sensitive as possible to differentiating students who are at risk and not at risk for the areas that the screener assesses, such as internalizing problems, externalizing problems, or social difficulties. While reliability is important, screeners also need to be sensitive to change in a way that measures developed to inform a diagnostic evaluation do not. A screener should be sensitive to change so that when we implement an intervention, the screener can detect progress in response to the intervention if the intervention is effective in targeting the need. For this reason, we need to balance reliability of the screener with the sensitivity to detect change in response to intervention. We want to make sure that our screening tools are not disproportionately or over identifying students from a certain background as more likely to be at risk based on their group membership. So we want to look at whether the norm sample and individuals included in research studies perform similarly when grouped by gender, race or ethnicity, language, geographic region, and sexual orientation. Our second guiding question should be, does the screener fit our specific needs? We know that the more culturally and contextually relevant interventions and assessments are for our school community, the more equitable and effective they will be in supporting students' behavioral health needs. When comparing universal SEB screeners for implementation in a school or district, we need to spend time thinking about what outcomes are most helpful to measure, and that we feel like our current processes are not capturing as well as we would like. What are the outcomes we are targeting through our MTSS framework? Perhaps it's social emotional skill development, decreased acting out behaviors that can result in ODRs, identification of those students at risk for anxiety and depression to prevent escalation to needing mental health crisis response services. We then want to determine if a universal screener provides us information that would be helpful in answering these questions about outcomes. What age group and grades are our school community? Some screeners have been developed to target more narrow age groups. If we are thinking of a district, what are the benefits of selecting a tool that can be implemented across age groups? Advantages may include being able to look at students' data across their school experience. This can be helpful for the individual student and for the district in looking at student outcomes in response to supports. This may also help the district in advocating for behavioral health resources. Disadvantages include that schools may have unique programming and developmental needs. They want to focus on different outcomes. Some screeners are only available in English. Considering your school community and equitable access, does your school need the screener to be available in other languages? If you cannot identify a screener in a language that your community needs, it can be incredibly valuable to consult with stakeholders from the community who speak the language and have familiarity with behavioral health concepts to get their input to consider questions around availability of screening tools in this language and possible translations of existing tools if none can be identified. Your team should spend time thinking about who would be the most helpful informant or person to complete the screener based on your school or district's needs. Screeners vary in the forms they have available. Some have a combination of teacher, parent, and student rating forms, while others are limited to one of these informants. Who you want to complete the screening depends on who is in your school community and what you are measuring. Students in second grade and younger struggle to accurately self-report on their own internal experiences. So self-report won't be appropriate for this age group. However, for older students, self-report would likely be the most appropriate for assessing internalizing problems. Teacher ratings may be most helpful for behaviors related to performance in the classroom or academic behaviors. It can be really helpful to utilize a screener that organizes students' screening results into a tiered model to support schools in making intervention-related decisions. Our third guiding question, and an incredibly important one for busy schools with limited resources, is how efficiently can the screening process be implemented? In considering how much the screener costs, make sure to consider how much time and personnel resources it will require to collect data, enter data, understand what the data means, and then communicate this data to teachers, school-wide, district-wide and community-wide so it is usable. This is particularly important to consider when selecting a screener that is free financially, but requires significant time and personnel resources to get to a point to be able to be used so it is helpful to students and teachers. Screeners that are completed online require less time and personnel resources to enter data and generate reports, but they may require time and personnel resources to train raters to complete. As your team is considering selecting a universal screener, it is necessary to consider how this screening data would be built into existing teams to support database decision-making. If your teams are just beginning the work of database decision-making, we suggest you begin your work with conducting a needs assessment to identify your school's existing systems for assessment, instruction, and database decision-making. This will help guide your team in determining how universal screening may be able to help you fill in gaps and fit into your existing systems. To improve buy-in to screening procedures across staff groups, it is recommended that a screener be less than 25 items and administered 2 to 3 times per year, so informants don't feel like it is taking time away from their main job responsibilities. So that's less than 25 items total and administered 2 to 3 times per year. And that the screener help with making more efficient intervention-related decisions. And thinking about the training and support different screeners would require, it's helpful to think about whether informants would require a one-time or ongoing training. Questions are important to consider, like, have the authors of the screener already developed a training for informants, or would your school have to create one? This is perhaps the most important element of the process of selecting a universal screener. Solicit input from students, parents, and school staff in this process of comparing available screeners. This will help with buy-in and support the implementation process. This could look like working with your school or district's family liaison to involve parents or caregivers and community partners in focus groups around the relevance of universal screening tools for your community and how to use the results to inform interventions in a meaningful way. As your team reviews screeners, consider how, if you selected the particular screener, that you would be able to share screening results with teachers, parents, students, and district level staff. We know that regular sharing of screening data encourages people to continue completing screeners. Here are some examples of screeners that your team may want to consider. This is not an exhaustive list, but just a list from where to start. Please see these helpful resources for selecting a universal screener for more information. Thank you for joining to learn more about selecting a universal screener. We want to thank you for your time and attention to the behavioral health needs of students. We ask for your feedback at the link in the description of this webinar, and we ask that you visit our website for more information. At our website, you can sign up for our subscription list to get more information on best practices such as universal screening. Thank you.